Welcome, medical students. Today we will talk about the acute respiratory failure. And we have the basic point that will be discussed in these topics, which are be taken from this box: the emergency medicine, the definitions, meaning, causes, clinical presentation, evaluation, and others. So, definition means acute respiratory failure is acute impairment in the oxygen or carbon dioxide exchange that results in or has the potential to result in potential morbidity or mortality. So, impaired ventilation causes hypercapnia. So, elevation in the carbon dioxide tension will impair perfusion or diffusion leading to the hypoxemia. In generally, the patient will be have BO2 less than 16 or the BCO2 more than 15 with arterial blood pressure less than 7.35. So this definition of the acute respiratory failure means impairment in oxygen or carbon dioxide exchange. So, in patients with chronic conditions such as COPD, so respiratory failure, definition as a PCO2 is higher than the baseline, with the current decrease in serum BA. There is many causes that causes the acute respiratory failure, such as airway obstruction, congestive heart failure, pulmonary embolism, muscular fusion, pneumonia, pneumothorax, toxic inhalation, and ARDS. So, if any problems can be leading to the impairment in oxygen can be causes the life-threatening acute respiratory. There is many signs and symptoms of the acute respiratory failure because the oxygen is essential for every point in the body's brain, heart, lungs, and others. So symptoms may be, and the most common symptoms is dyspnea, confusion, agitation, lethargy, seizures, cyanosis, use of accessory muscles. Children also maybe have nasopharyngeal or retraction. This is a sign of the acute respiratory distress. And the physical examination is tachycardia, tachypnea, mild hypertension, bradycardia, and the hypercapnia, wheezing, raise or decrease plus sound, depending on the underlying cause. 4 point important in evaluation and diagnosis. The most important step is the history and physical examination. Another is chest radiograph to determination underlying cause. Ultraviolet gases is very important. Pulse oximetry and ancillary tests depending on the suspected cause, such as ACG for congestive heart failure, pulmonary angiogram for the embolism, urinary toxicology for the overdose. This is evaluation and diagnosis of acute respiratory. How to treatable the patient with acute respiratory failure. Acute respiratory failure, this is case is emergency and this is life-threatening. So this is airway, breathing, circulation, specific therapy. The airway, oral, tracheal intubation if airway is compromised. Breathing, oxygen is very important. And the problems and main problems in the acute respiratory failure is impaired in oxygen. So the oxygen must be maintained saturation at least more than 90%. Mechanical ventilation of BCO2 more than 50 and pH less than 7.13. Okay, circulation to IV lines for the fluids and medication, specific therapy to be underlying cause treatable, such as diuretics for the congestive heart failure, beta-2 agonist for asthma, COPD, substitute for pneumothorax and hemothorax. So the treatment is a very important step in the acute respiratory failure. Acute respiratory failure must be ICU admission for all the patient with acute respiratory failure because this condition is the life-threatening condition and clinically stable patient with a risk of deterioration should be also closely monitored in ICU or monitored unit. So this is brief summary of the topic of the acute respiratory failure about definition, signs, symptom, diagnosis, and treatment. Thank you for watching and thank you for following.